The Brain Injury Guide and Resources is a tool for professionals, community members, and family to understand traumatic brain injury, as well as how to promote better living for those who live with a TBI. In this interview, we will talk with Dr. Keely Diedrich, a pediatric neuropsychologist with the MU School of Health Professions, Department of Health Psychology, to learn about children with TBI. And Keely, thanks very much for being with us. We appreciate it.
Thank you.
What are the most likely ways that a child might sustain a TBI?
So the causes of TBI vary by age. So for young children, infants through preschoolers, about that 0 to 4 age range, the most common cause is a fall, tumbling down the stairs or something like that. Other causes at that age are things like motor vehicle accidents, and also child abuse is a leading cause at that age. As kids get older and move into adolescence in that 15 to 19-year-old age range, the leading cause is motor vehicle accident.
Mm-hmm. What are the differences between dealing with a child with TBI and an adult with TBI?
So working with a child with TBI is different because that child's injury occurs within the context of a brain that's in the process of developing, so that the child is healing from injury at the same time that their brain is also developing.
Mm-hmm. Does that make it more of a challenge to deal with a child when the brain is developing?
In some ways, yes. So in the past, we used to think that because a child's brain was developing and could reorganize, that they might have a better recovery than an adult whose brain development is completed when they have their injury. But what we found instead is that the types of skills, the cognitive skills that are most vulnerable to a traumatic brain injury are those that haven't developed yet or are in the process of developing, so that actually younger children are more risk for more sequelae from their injury.
Mm-hmm. So often we're dealing here with school-age children. Do you work with schools in helping them to be more effective with kids with TBI, and how do you do that?
Absolutely. So what I try to do is to team up with teachers and with parents as we plan the process of getting a kid back to school. Getting back to school is often a parent's first concern, and a kid's first concern is, when can I get back to school? And so working with them to plan things like how should that reentry to school happen? How quickly should it happen? Should the curricula be modified in any way? What length of day is appropriate? And how quickly to step up the length of day or the challenge in the curricula are important. Other things that I try to work with teams to think about are things like physical accommodations for things like kids who are in wheelchairs or who are having trouble with fine motor skills. And then thinking about how to accommodate cognitive issues like attention problems or fatigue through sitting a kid closer to the teacher so they can pay attention, or giving more frequent rest breaks. And then kind of planning what kinds of therapies they might need and whether or not they might need some specialized instruction in a small group or one-on-one setting to address issues with memory and learning.
Mm-hmm. Keely, in the school setting, are you finding that teachers need some additional training as well so that they can deal with these kids more effectively?
Sure. I think most teachers have all the tools that they need already in their toolbox to work with these children. What they're not as familiar with is what TBI is and what that looks like in a child as they recover. And so for most teachers, what they need is some information about traumatic brain injury and how to help and how to use the tools they already have to best support that child as they recover.
Mm-hmm. What are some interventions or supports that are helpful to children following a TBI?
I think the most important things are to consider, first of all, how do we need to accommodate some of those difficulties by changing the environment. So for example, providing a quiet place to do work, or providing those rest breaks during times when there might be fatigue. Thinking about compensation, so teaching children ways that they can compensate for any deficits that might be residual after their injury, like typing instead of handwriting or something like that. And then again, thinking about what types of specialized instruction they might need to be able to work on memory and learning deficits.
Mm-hmm. A TBI obviously affects the entire family, Keely, so what are some issues related to the family that families need to be aware of?
Certainly, having a child who's had an injury is very stressful for families. And what we try to do is to try to help families get through that in as positive a way as they can. And what we try to do is help them mobilize their support system, their family, their friends, community members, and their medical team, so that when problems arise, they can handle those problems in a calm fashion and be able to work through those in a way that minimizes the stress to the family. If we can keep families on that path towards positive solving of problems that come up, then we can enhance the child's recovery.
All right. Keely, thank you very much for being with us. We appreciate it.
All right, thank you.
And thank you for watching this interview on Children and TBI, a service of the Brain Injury Guide and Resources.